I think a really important thing we need to realize as speech language pathologists who are treating singers is we need to be very sensitive to the stigma of vocal injury. I recently did a blog on atempovoicecenter.com, which is my website, and I talked about the fact that athletes and other famous or well-known individuals, celebrities almost, they kind of can get away with being injured. And it's not like, oh, it's career ending for them. But with a singer and someone who relies on their voice for a living, there is such a higher stigma for that and feeling of a shame that comes with that. And no one wants to tell anybody that they're really suffering for fear of retaliation, being cut from the cast, everybody encouraging them to just push through. They may feel like it is being seen as a weakness. So you need to be an advocate for your patient, because no one else, not their manager, not their cast members, not themselves, without encouragement from you, is going to feel like they need to set limits and need to rest when they can, and they really rely on you to help them set those boundaries for themselves and be an advocate, so that they can be an advocate for themselves. It's also different for speech pathologists who work with injured singers, because you think vocal pedagogy and training for musicianship, you're focusing in those lessons on things like diction, melodic intonation, the notes that you're supposed to sing, the words, emotion, how to phrase these things, dynamics in the music and how you're going to communicate your musical and artistic message when you're performing. But very seldomly does an artist, singer, actor get education on vocal science, what their voice box looks like, what their laryngeal muscles are, how they work, what can go wrong, what they actually look like. And so I feel proud and excited to be able to share video stroboscopy with my patients, because many of these singers have never seen what their vocal folds look like. It's all this mental game where they have to perform and be their own instrument, whereas a guitarist or a violinist can see the instrument outside the body and have a good understanding of the mechanics of that. Singers have to rely on proprioception and the feeling of what they're doing when they create sound. And I remember treating, this has been many years ago, but treating a professional opera singer, and she told me, because I kept thinking, what am I going to do to help this patient? We fixed her problem to a point. She kept coming back, and I kept thinking, I feel like I've done everything I can. I've educated her enough. But what she told me she was getting out of our sessions was education and reminding herself of breath support, of efficiency of sound production, of the voice science part of things, because in her lessons it was always diction and phrasing and create this and try this line again this way. Not saying I don't do that in my sessions too, but there's a science basis for what I'm doing with evidence for specific techniques, and she found that really, really appealing and helpful for her. So some of the things I do for patients to help them warm up is the science behind semi-occluded vocal tract exercises. And so one of these, there's multiple. There's this kind of the hierarchy of what's least like speech or singing and what's most like speech or singing. But there's a trade-off. You have this continuum where if the semi-occluded vocal tract exercise is least like speech, you're getting the most back pressure. And Ingo Tietze talks about this a lot. So this would be your small diameter straws. Or having your singer perform a song. And then going from that to words, where you've created that back pressure, you've allowed some recoordination here lessening of the collisions of the vocal fold tissue for a better balanced system. But you walk down that hierarchy. Closer in the middle is lip bubbles, lip or tongue trills, moving further down, and then eventually ooh and ee vowels. So somewhere in between there too, I teach them to use wave in a cave or cup phonation, where they're able to use the words of their song. If you can hear them that well, they don't have a good enough seal around the mouth, but that's also providing back pressure to help them warm up with words so that they can then from that advance to and feel vocal freedom from scientifically and physically what was happening when they were completing that semi-occluded vocal tract exercise. Another great technique that I'm making sure that I teach patients is the messa di voce. So the idea of crescendo, decrescendo in one note. It's a very hard skill, but it's going to help improve the vocal fold's ability to vibrate and improve skills. So having them choose a semi-occluded exercise they like, so maybe lip trills, so they can start managing how hard they're squeezing the vocal folds together to get sound, how much breath they're putting through, so they can help learn to manipulate that in a safer way. So I hope that this was helpful. I love that y'all are having this symposium, and I just wanted to give my 2 cents or give a little education about what I feel that I do differently versus a speech pathologist who may treat articulation, neuro problems like traumatic brain injury or post-stroke aphasia. I'm truly working to rebalance the subsystems of phonation, and then prevention, right? And myth busting as well. So I'm educating people with these research studies that eating and drinking dairy products does not increase mucus production. It may temporarily thicken your saliva, but I think singers are very superstitious about what they're putting in their body. They like their ginger tea, their lemon tea, they're feeling that's coating the vocal cords. But I like to inform them that although that's happening and you feel good, it never touches your vocal folds. It's the tissue around it that you're feeling that relief from. That dairy products, if you're lactose intolerant, maybe tomato-based products, if you're avoiding those, it's a reflux issue. And it's not necessarily that it's coating your vocal folds and vocal cords with heavy things. It could make you feel bloated, and so that's why you want to avoid those things. I'm always educating them with the science, but I'm never saying, here's what you have to do because I said so. I'm not gonna say you have to not drink this or you need to drink this before going on stage, because performing is such a mental feat to do, and so the performer has to be comfortable, but I always like to arm them with the knowledge of science. Thank you so much for having me. I hope this was helpful. I hope you'll check me out on Instagram. I post a lot of voice science. My tagline is @Christie_voice, and that's KRISTIE_VOICE. My website again is www.ATMPO_voicecenter.com. My email's on there, my blogs. I make a line of kid and adult friendly voice rehabilitation products available for download. Some are in Spanish. Quite a few of mine are in Spanish. I haven't done Portuguese yet, but that's on my list of things to do. I really appreciate you having me on, and thank you.